So quality versus cost. It's a real dilemma in healthcare. Two key parts. The first part is the long-term thinking. So back to that tuberculosis screening program. The long-term thinking, yeah, we can save $1 million today, but what's the long-term cost? So we need to think beyond today. We need to think about what's going to happen down the track. The second part is having a strategy. There's no point just cutting costs or changing something if there's no plan, if there's no outcome to say, well, we're going to make these changes because this is where we're going and this is where we think we can get to. We need to have both of those components. Without either one, it just doesn't work. How much is a cheap hip implant? Some of you will recall the titanium leaching out of I think it was J&J. I don't want to bag them if it wasn't J&J, but one of the major companies, their hip replacements, unfortunately releasing toxic heavy metals. But they were cheap. And this is our dilemma. We need to find a balance between providing high quality care, but we need to be able to do it at an affordable price. So cheap is not always good, as we know. What's it cost just in financial terms for somebody to have a hip replaced and then 5 years later have to have that hip replaced again because it's dodgy? And then what's the cost on the patient? 2 operations. One of the things that we need to think about is how do we make sure that we're not causing more harm than good? And it's part of our NMBA standards, non-maleficence. We need to make sure that we don't cause more harm than what we're actually trying to fix. So as a registered nurse, we are all bound by these standards, and yet we still have patients who turn up with dodgy hip replacements, dodgy heart valve replacements, dodgy corneal replacements, and I can go on. Part of my previous life, I did a whole bunch of work with the federal government revamping the Australian healthcare supply chain. So we brought in a whole heap of standards that didn't exist. And one of the reasons, one of the big drivers for that was to start identifying things that were dodgy so that we can say right up, we're not using those. We'll find another supplier. Yes, it might cost us more, but what's the end cost? So we need to look at it as a whole. Cost-benefit analyses, and I'm sure that you've all come across these and you probably all have to do them regularly in your roles. I don't think that we've done it very well in nursing over the years. I think we have a much, much better appreciation now for things like cost-benefit analyses, but I think we still have work to go. We still need to do some more on that. And it's something that's really important. So regardless of what your role is, we should be looking at cost-benefit. What are the costs of these dressing packs versus these? Simple idea. Well, these ones are 5 cents cheaper, but they only have 1 set of forceps and I need 2. Stuff like that. So drilling down into what we're paying for, what are we getting, what are the services that we're trying to achieve, so what are the things, the outcomes we're looking for.